Massachusetts downgrades its travel order to an advisory today, even as some public health officials worry that movement between states could trigger another surge of COVID-19. Here to answer your questions is Dr. Robin Colgrove, an infectious disease specialist at Mount Auburn Hospital. Good to see you.
Nice to see you.
So this new advisory no longer requires people to quarantine or take COVID tests when they enter Massachusetts. Do you agree that we're in a safe position right now to make that change?
Well, the quarantines, if vigorously applied, they do work. If you actually stay home for the first 14 days, that's very effective, but you have to do it. So this is really just a change from requiring to advising. And I think if people diligently follow those things and continue to wear a mask and distance, I think this will be effective.
We know there's this more contagious variant of COVID-19 spreading across the U.S. right now. Do you think we've vaccinated enough people in Massachusetts to stop it here locally, or at least to slow it down?
Short answer, no. We don't have enough people vaccinated yet to stop this. The vaccines are not a panacea that's going to relieve us from all the other requirements. However, vaccination plus natural immunity plus masking plus distancing, all those things are going to help. And in particular, we have a large fraction of people in the most vulnerable populations vaccinated, so in the nursing homes, for example, so that ought to help. And we have a large fraction of frontline healthcare workers vaccinated, so that should help making sure that there's enough staffing to support people when they do get sick.
All right, so it sounds like hopeful on some front there. This is also hopeful. Today, AstraZeneca releasing new data from its vaccine trial in the U.S. Talk to us about what this shows about safety and also efficacy.
Yeah, short answer, this is good. So I would advise people not to fixate on the exact numbers because there's a lot of subtleties here. But these are highly effective, very safe vaccines, and these are going to be very helpful. The AstraZeneca vaccine in particular may come too late to make an enormous difference here in the U.S., but globally it's likely to be very important because it's easier to store, cheaper to manufacture, all those other things. So this is a really good step.
All right, well, that's good to hear. I want to ask you about this because these pictures have a lot of us kind of shaking our head. The mayor in Miami Beach says his city is facing a public health crisis with tourists on spring break. We're showing this video right now, Dr. Colgrove. Many gathering in large groups. They're drinking, they're not wearing masks. You've been on the front line of this pandemic since day one. So when you saw these pictures, these images, what was your reaction?
This is horrifying, but not surprising. And historically, human folly is always a major factor in the spread of epidemics, and this is no different. But still here, the defiant recklessness of people is dispiriting. And I would say, I would just really plead with people, as someone who has seen this from the very start, not to go there, to remain vigilant for at least the next several months until we can really roll out the vaccines. In this group of people, it's statistically almost certain that some of those people are infected, that some will infect other people, and some of them will go on to infect other vulnerable people and hurt them. So this is really irresponsible.
So just remain vigilant. Good advice. All right, Dr. Colgrove, thank you for your time. We appreciate it.
My pleasure.
It is a